I want to have you rotate your neck slightly. Take a big deep breath and let it out. Good. How's that?
Good.
There it is.
How's that? Nice. Feel a lot looser.
Hey guys, at the Clerge, a DMV chiropractor, and actually I have a special guest today. This is Dr. Margie. Am I saying it right?
Yes, you are.
And you're a surgeon, well, surgical resident, right?
Right, yeah. Right. I'm a surgical resident at Georgetown University Hospital.
Okay, and you guys are working like hell, right?
Yeah, we work about 80 hours a week, plus or minus. Yeah.
Wow. You work just as hard as me,
Yeah.
basically.
Yeah.
Because I'm here 7 days a week sometimes.
Right, yeah.
Long hours, you know.
Yeah.
So I'm assuming you're in a forward head posture for an extended period of time.
Right, so yeah, when we do, some of the longer surgeries can take, 4, 5, 6 hours, and kind of, like you said, in that forward head posturing with a lot of strain on my cervical spine.
Got it.
Yeah.
Okay. And you stated that you're having also lumbosacral issues as well. Now it's starting to play a toll, basically.
Yeah, so also kind of just being up long hours and running around the hospital, when it's all said and done, my shift's over, start to feel some of that lumbosacral
Gotcha.
back pain.
Okay. Yeah. And you've been to a chiropractor, you said like years ago, you were in high school?
Yeah, it was a long time ago.
Okay.
It's certainly been a while.
Okay,
Yeah.
I see. So what we're going to do is assess range of motion, okay? I want to see what's recreating the pain,
Sure.
if it recreates it.
Sure.
And I want to see if there are any restrictions with your motion, especially with the cervical, okay?
Yeah.
Any like lateral flexion, rotation. And the goal of the adjustment is to increase your range of motion, decrease stiffness. That way it'll alleviate some of the pain that you're having, okay?
Okay.
And then before we adjust, the young lady's going to stretch you out just to increase your muscle flexibility.
Yeah.
And then we'll adjust.
Okay.
After the adjustments, we'll focus more on muscles. So we'll do massage. They kind of decrease a lot of muscle tension.
Okay.
Okay?
Yeah.
All right. So
Sounds good.
let's have you on your stomach for me first. So now I'm just going to palpate because I know you said you have a lot of tension in this area right here, okay? All right. So I'm just going to palpate that muscle, okay? Are you ready?
Yeah, I'm ready.
All right. So a bit of palpation. Is that tender or what are you feeling? Is that okay?
Yeah, that's okay.
That's fine. Okay. Trying to see if you have any trigger points. That's fine?
That's fine.
That's fine. Okay, I got you. Is that okay?
That's okay.
That's okay. Pressure, mid-back, is that okay?
That's okay.
Pressure, is that okay?
Yeah.
That's fine. Is that okay?
Yeah, that hurts a little bit.
That hurts a little bit.
Yeah.
Pressure in that lumbar area.
Yeah.
All right, so a little bit more pressure, but in the SI joint area, so
Yeah.
I'm applying pressure. How's that?
That's okay.
That's okay. Now the other side, how's that?
That's okay.
That's okay. All right, so I'll apply that pressure. What I want you to do is lift this whole leg off the table for me. So you're just gonna lift it up. There you go. Any discomfort with that?
No.
No? Okay, bring it down. Same thing on this side. Let's bring it up. Any discomfort with that?
No.
That's fine.
Yeah.
Okay, all right. So let's have you stand up for me.
Yeah, sure.
Good. Let's have you flex forward, but do not bend your legs. Let's try and touch both feet.
Okay.
Let's see how far you go, and if you feel any tension, soreness, stiffness, anything. How's that?
It hurts.
Where?
Kind of like in
Upper?
scapular area and
Okay.
a little bit neck,
Okay.
and then my hamstrings are kind
Of
of tight,
course,
but
yeah.
like
You're gonna have to tighten this
yeah,
in there.
but well, it's kind of like in the medial-scapular area.
Gotcha. But no issues with the lower back with that, right?
No.
No? It's actually pretty good. Okay. Let's have both arms up.
Mm-hmm.
We're going to rotate right and left, but don't do it yet though.
Okay.
I'm going to hold on to your hips. That
Yeah.
way the motion is strictly lumbars.
Okay.
So let's rotate to the right for me. Good. How's that? Is that uncomfortable?
I mean, it's just a little tight, but no.
But no major issues, no pain.
No pain. No
Gotcha. Let's go to the other side. Go to the left. How's that?
Same thing.
Same thing.
Yeah,
Okay.
just a little tight, but no pain.
But no pain. Okay.
Yeah.
All right. So let's do some lateral flexion, but
Okay.
do not bend forward. It'll be strictly side bending. So
Okay.
to the right, to the left. Okay.
Okay.
And I'm gonna observe and see how far you go with that. How's that?
It's good.
That's good?
Yeah.
Let's go to the other side. How's that?
It's good.
That's good?
Yeah.
Okay. All right. Have a seat. So let's look at your range of motion, cervical range of motion. Okay. So first I'll have you go into flexion.
Uh-huh.
And you let me know if you feel any strain, any pain, any discomfort, especially in that cervical area.
Okay.
All right. And how's that?
Yeah, that's tight here.
That's tight when like occipital?
yeah, like
Okay.
exactly occipital area. That's tight.
Okay, gotcha. Let's have you extend. So we're gonna look back and let me know if you feel anything. What's going on?
Yeah, that's like lower sacral.
Lower sacral, gotcha.
Lower sacral pain.
Okay, all right. Let's have you go back to normal position. This time we're going to rotate right and left, but I'm going to hold on your shoulders.
Okay.
That way you're not recruiting shoulders to
Yeah.
help with the motion.
Okay.
So let's have you go to the right for me. That's okay?
That's okay.
Okay, let's go to this side. What are you feeling?
That's okay. There's a little bit like sternocleidomastoid. Like,
Okay.
pain.
Tightness or
Tight.
pain?
Yeah, a little bit of pain
A little bit of pain
on that side.
on
yeah.
that side. Okay. Let me go ahead and apply a little bit of pressure. You let me know if you feel anything. Pressure. How's that?
Okay.
Rotate to this side. Pressure. How's that?
Fine.
Pressure. How's that?
Fine.
That's fine. Are you sitting on your stomach?
Who God knows. Usually on my back or my side.
Back of your side.
Yeah.
Okay. So yeah.
I don't really sleep on my stomach.
Okay, that's perfect. Yeah, because you know your stomach is the worst position to sleep in.
Yeah.
Yeah.
Usually on my side or my back.
Oh, your back. Okay.
Yeah.
Are you keeping your legs elevated? Not really.
No.
Nobody does that, but you should.
I definitely should.
Yeah, it'll decrease the tension, especially in that lower back.
Yeah.
After a long shift, that's the way I sleep. You know.
Really?
Yeah, my wife makes fun of me, but it works. You know,
Okay.
and it helps also.
Like a couple pillows.
Yeah, I have like a big foam, a large foam. Now, okay, so when you're laying the back,
Yeah.
so do you feel a difference already with that?
Oh yeah, that feels good.
Feels good, right?
Yeah.
Yeah, so that's what I use. I don't use that particular brand, but
Yeah.
any cervical pillow will work.
Okay.
You know, as long as it supports, because you know you have a curve, the curvature in the cervical spine, it'll
Yeah.
support it.
Yeah.
So that helps. So already you should feel a difference as far as the tension
I do.
in that cervical spine.
I do.
So to make that even better, okay, I use a foam, but my foam is actually probably twice the size of this thing here. And it's soft.
Yeah.
And you place this underneath your legs.
Yeah.
Yeah. So you should, like, it should be a little bit,
Yeah.
you know, larger than that,
Uh-huh.
but you should feel a difference already.
I do.
Because that tension right here in that lower back,
Yeah.
it'll definitely decrease it.
Yeah, for sure.
Now, the only issue is to stay in that position for a long period of time. You know what I mean?
Yeah.
Right. But if you've worked like,
I think I could sleep through this.
if you've worked like a 20-hour shift, you know, or
Yeah.
whatever, you
Yeah.
probably will fall asleep right away anyway.
Yeah.
Okay?
All right.
So what we'll do, we'll start with some stretches, okay?
Alright.
Just to kind of increase your flexibility, because I'm sure you're not stretching. Not really. You don't have time for that, right?
No, I mean I should be.
Do you go to the gym? Like, do you have time for that?
So these last couple months have been like just straight work.
I understand. Yeah.
But yeah, stretching and kind of a more, you know, training would definitely
Yeah.
help my cause
Right.
for sure.
So I'm going to start with some neck stretches today. I'm
Okay.
going to apply a little pressure here, and I'm going to stretch your neck both ways. At any point, if it gets too tight or uncomfortable, just let me know, okay?
Okay.
All right, so go ahead and start by taking a big deep breath for me, and let it out. How's that?
Good.
Do you feel like I can go a little further?
Uh-huh.
Okay. Okay, I'm gonna do the same thing on the other side. So big deep breath. And let it out. Good. How's this side?
Good.
All right. Big deep breath for me. And let it out. Good. Okay, I'm gonna do it one more time on the other side. Big deep breath. And let it out. Good. So this time I want to have you rotate your neck slightly. Take a big deep breath. And let it out. Good. How's that?
Good.
Feel like I can go a little further?
Yeah.
Okay. Is it too tight there?
Oh, it's good. Feels good.
Okay. And we're gonna go ahead and switch. We're gonna do it on the other side. So slightly, big deep breath for me. And let it out. Good. Okay. Back to the left. Go ahead and turn your head slightly. Big deep breath when you're ready. And let it out. Good. Okay, and last time on the right side. Go ahead and turn. Big deep breath. Go ahead and let it out. Good. Okay? So now we're going to do some stretches for your back. Go ahead and take a big deep breath. Go ahead and twist out. Let it out. How's that feel?
Oh, it feels good.
Good. Good, good. Now let's go ahead and switch to the right side, okay? Big deep breath. And let it out. Good. Yeah, keep breathing. Good. All right, let's go ahead and switch. Big deep breath. And let it out. Good. Twist for me a little bit and let it out. Good. All right, so what we're gonna do is we're gonna place our hands on the floor here. So remember, yep, come down some. Is that too tight in here?
That's a little tight, but it's good.
Okay.
We're good.
So place your hands here. Remember that they have to stay down. Lock your elbows. You're gonna drop your head and take a big deep breath. And as you're exhaling, you're literally just sliding your hand out without lifting. Just sliding. Yep, that way. Keep sliding down. But you want to make sure that you're exhaling that breath throughout the process. Yeah, just like that. Just keep dropping your head down. Do you feel like your head can go down further? Yeah. Good, good, good. All right, hold it like that. Good. Go ahead and come back up. Go ahead and take a big deep breath for me. And go ahead and let it out. Good. You want to come down. Big deep breath. And go ahead and let it out. Good. Okay. Big deep breath when you're ready. And good. And I'm going to come up, and I'm pretty much going to stretch your leg this way. How does that feel? So big deep breath for me.
Yeah.
And let it out. Is that too tight?
It's super tight.
Okay. But is it unbearable?
No,
Okay.
I can handle it.
I'll try that again. Big deep breath. And go ahead and let it out. Good, good, good. And let it out. Good. Good, good, good. I'm gonna come down. Big deep breath. And out. Good, good, good. One more time on this side, okay?
Yeah.
Start. Big deep breath and out. Good, good, good. And remember, if it gets too tight or unbearable at any point, just let me know, okay?
Okay.
So big deep breath and out. Good. So once you're ready, big deep breath, okay?
Okay.
Good. Let me know when. Good, good. Okay. All right. Big deep breath when you're ready. Good. Good.
From all the, well, I mean, you were tight, you know,
Yeah,
before
I
the
mean-
stretches. Are you?
I feel it.
You feel it,
I feel
right.
like I just got stretched out.
Right, right.
Um,
So it's just something that you need to do more often, basically. Yeah. So
Yeah.
let's reassess your lumbar motion.
okay.
I'm gonna apply a little bit of pressure, but I'm gonna stay mainly in that lumbar area,
Yeah.
and I'm just going to palpate the spinous process right here. And I want you to rotate to the right for me. How's that? Is that okay? No pain or nothing like that, right? Oh, no. Let's go to the other side. Rotate. How's that?
It's good.
It's good.
Yeah.
Okay. Now focus more on the S side joint. Go ahead and rotate for me again. This time extend. How's that?
It's okay.
That's okay. Okay, that's good. Let's go to the other side. Extend. How's that?
That's okay.
That's okay. All right. When do you feel the pain the most? Like what movements? Or is it because you're standing for a long period of time, or if you're sitting a certain way? Like what recreates that pain?
Like I have pain right now.
Okay.
Like when I so like this obviously like this feels good.
Right. Of
When
course.
I'm in like
When you go back.
normal anatomical position, that's where like I feel like literally from the from the occipital
Mhm.
to like
To the lumbar.
like yeah all the way to the lumbar. I feel it like all the way down.
All the way down.
Just-
But only when you're trying to be in that
Yeah.
upright position.
yeah,
But if you're just sitting,
just sitting like this. With
it
like,
kind of relieves it.
It relieves it.
I
yeah.
see. I see. Okay. Let me have you on your side. So I'm going to focus on the lumbosacral area.
Yeah.
And the point is just kind of increase that range of motion. And then after that, we'll do the lumbar on the other side. And then you'll let me know how you feel. Okay?
Okay.
I'm going to position you.
Uh-huh.
Let me raise this up. You're good. You're good. All right. So I'm going to squirt your shoulder and position you like this. There you go. Good. Head goes right in that groove for me. Just like that. You're going to bring your body closer to the end of the table. Like that.
Uh-huh.
Okay? Just this motion. Just like that. There you go. Perfect. We're going to straighten this leg out. Good. We're going to bend this leg. Now, it's going to feel like you're falling off the table. You're not. Okay? I just want you to relax for me. It's an awkward position to be in, but you got to relax.
Okay.
I got to be able to twist you. Just relax. Take a deep breath for me. Let it out. Oh, yes, sir. Yes, sir. Was that painful?
No, that felt good.
That felt pretty good.
Yeah.
Okay. That conk sound,
Yeah.
that was the lumbosacral area, okay? Because sometimes back pain is like SI joint dysfunction,
Yeah.
so we just want to increase that motion. Now I want to focus on the lumbar to increase motion in that area, okay?
Okay.
So let's have you on this side. Same scenario. The positioning is about the same, but I'm just gonna, my contact point is gonna be a little different. So let's position you again, right here. Good. Now, same scenario, this leg is straight. I'm going to bend this leg, but this time, I'm gonna reach in, stabilize your lower thoracics,
Uh-huh.
and I'm gonna apply a little bit of pressure. Now, is that painful?
No.
Take a deep breath. Let it out. Felt it. There it is. Yes, sir. That was lumbars. Was that painful?
No, it felt good.
Come on up. Okay. Let's do the ranges of motion for me again, and just let me know how you feel
Okay.
as far as the lumbar. So
Yeah.
stand up, rotate right and left. Any pain? I mean, you didn't have pain with that
No.
motion, but do you feel
No.
a difference as far as like how far you can go?
Yeah, I feel like I'm limited more like
On that right side?
I think I'm limited more like
The thoracic.
yeah,
Okay,
up-
we'll take care of
up
that
up
next.
top.
Gotcha.
You know, I feel like my hips are like my hips feel like loose,
Mm-hmm.
or like my lower like sacral lumbar area feels
Okay.
loose.
Okay.
But then like right up here, I start to feel like
Feel
like it's tight.
Okay, gotcha. Right hand. I'm gonna focus in this area here. Bring both arms up like this. Good. Let's have both legs apart from you a little bit. I'm gonna reach in. Take both of your hands, interlock them, put it on top of my hands. Good. Squeeze your elbows for me. I'm gonna bring you back. Squeeze harder, harder.
Oh,
Wow, you're super tight. Nothing there either, right?
I think it was a little bit better.
A little bit, but nothing. Yeah, it should. We should have had a little bit more. Okay.
Yeah.
All right. So I see. So this is all muscle, not spine. All right. So let's do this. Let's focus on your cervical thoracic region. Just relax for me. Relax. Okay. Was that painful?
No, not really.
Not really. All right. Let's keep it. Just relax for me. Relax. Good. How was that?
Nice.
Felt pretty good?
Yeah.
Okay. Not painful though.
Not painful.
Okay. Let's sit up for me. So, I know you had a lot of tension, especially like you were doing this a lot. So let's do that motion for me again. Let me know if you feel a difference. And then we'll focus on the next segment.
A little bit, yeah.
A little bit? Okay.
Yeah.
Gotcha. All right. So now we're going to focus right here. So next adjustment is going to be mid-cervicals, okay?
Okay.
So C, 3, 4, 5, okay? I want you to just relax as much as you can, all right? All right, so what I'll do is I'm going to palpate first, and then when I tell you to drop your head, you just drop your head, okay?
Okay.
All right. So where my fingers are palpating, that's what we're focusing on. Go ahead, drop your head for me. Not too bad?
Not too bad.
Was that painful?
No.
No. Okay. All right. Move your head around for me. Just let me know how you feel overall.
Pretty good.
Pretty good?
Yeah.
Okay. You probably will still feel that tightness.
Yeah.
Yeah, in that area, because that's muscle. Okay. Now, in here, before we go and do massages, okay, I want to see if I can increase a little bit of that motion right in here, okay? It's so tight, I don't predict anything will happen, but what I want you to do, you're going to sit like this and just face this wall for me. This is super tight. It's probably from all that standing you're doing too. All right, I'm going to have you hold yourself like this. Good. And I'm going to bring you down and just relax. There you go. Deep breath. Again, deep breath. Out. Yeah, I figured that. Yeah, you're tight. Come on. Yep. So, the next thing we're going to do is massage from the neck all the way down to the lower back.
Okay.
And at the end, they'll do electrical muscle stimulation to kind of stimulate the muscle.
Yeah.
And you should feel much better, okay?
All
All right, come on. Let me have you move around for me. So the lumbars, we got a lot of movement. Cervical, we got a lot of movement. Cervical thoracic, we got a lot of movement. So just kind of move around and let me know from the initial time you started doing the movements, how do you feel?
Yeah.
Between the stretches and the adjustments.
I feel a lot looser.
A lot looser, right? Yeah.
Yeah.
Okay. All right, so now let's target muscles, okay?
Okay.
All right, okay.
Sounds good.